Imagine a hospital without doctors, patients waiting in endless lines, emergency rooms in chaos, and lives hanging in the balance. For 42 days, this nightmare was a reality in West Bengal. But now a glimmer of hope emerges as junior doctors end their strike and prepare to return to work. Today we are diving into the dramatic story of the Bengal's doctors' strike, a movement that shook the state's healthcare system to its core and captured national attention. This isn't just about the white coats and stethoscopes. It's a tale of tragedy, protest, and the fight for safety in Indian hospitals. Let's rewind to August 9, 2024. The body of Dr. Abhaya, a 31-year-old junior doctor, was found in the seminar hall of Archikor Medical College and Hospital in Kolkata. The shocking discovery sent shockwaves through the medical community. Evidence pointed to a horrific crime. Dr. Abhaya had been raped and murdered within the very walls meant to heal and protect. This tragedy wasn't just an isolated incident. It was the breaking point after years of mounting frustration over safety concerns in hospitals. Junior doctors, the backbone of India's public healthcare system, had long complained about inadequate security, long working hours, and the constant threat of violence from patients' families. Within days, thousands of junior doctors across West Bengal walked out of hospitals, demanding justice for Dr. Abhaya and sweeping reforms to ensure their safety. Emergency rooms emptied, surgeries were postponed, and only the most critical services remained operational. As the strike stretched from days into weeks, the impact on public health became severe. Patients from rural areas who rely heavily on government hospitals were left stranded. Many were forced to seek expensive private care or forgo treatment entirely. The state government, led by Chief Minister Mamata Banerjee, initially took a hard stance against the protesters. But as public pressure mounted and the healthcare crisis deepened, negotiations began in earnest. After 41 days of protest, a breakthrough finally came. On September 19, 2024, the West Bengal government issued a comprehensive 10-point directive addressing the doctors' concerns. This included deployment of adequate security personnel in hospitals, installation of panic buttons and CCTV cameras, creation of a centralized helpline for healthcare professionals, filling of vacant posts for doctors, nurses, and technicians, establishment of a robust grievance redressal system. In response, the protesting doctors announced a partial withdrawal of their strike. While outpatient services would remain suspended, they agreed to resume emergency and essential services from September 21. The impact of this decision cannot be overstated. For millions of West Bengal residents, it means a return to accessible healthcare. Emergency rooms will once again be fully staffed and critical surgeries can resume. However, the doctors emphasize that their fight is far from over. Aniket Mahato, a representative of the West Bengal Junior Doctors Front, stated, "We want to remind the government that our fight will go on till safety and security is completely ensured." The strike has also sparked a national conversation about the working condition of junior doctors across India. Many see the West Bengal government's concessions as a potential model for other states to follow. But not everyone views the outcome positively. Some critics argue that the prolonged strike put patients' lives at unnecessary risk. Others question whether the government's promises will translate into real, lasting change. As we look to the future, several questions remain. Will the government's directives be fully implemented, and how quickly? Can trust be rebuilt between doctors, patients, and hospital administrators? Will this movement inspire similar actions in other states facing healthcare challenges? The Bengal doctor strike serves as a stark reminder of the critical importance of healthcare workers' safety and delicate balance between protest and patient care. As essential services resume, all eyes will be on West Bengal to see if this hard-won compromise can lead to meaningful, long-term improvements in the state's healthcare system. What do you think about the doctors' decision to end their strike? Do you believe their demands were justified? Share your thoughts in the comment below. For those interested in learning more about the complex issue, we recommend the following sources: The Hindu's comprehensive coverage of the strike, the Indian Medical Association's official statements, and the World Health Organization's reports on violence against healthcare workers. Stay informed, stay healthy. See you in the next video.